Hi, I'm Deborah Graham. I'm a student at the University of Texas at Tyler in a Doctorate of Nursing Practice program. This semester, we have an assignment in our advanced epidemiology course to look at a local public health initiative or issue and do a public service announcement. So with recently, well, it was in October, two events happened. I overheard a conversation involved in same-day surgery at Cumberland Medical Center, my local healthcare provider, that there's been a diminished frequency and volunteer rate of auxiliary or hospital volunteers from our retirement community because the hospital now mandates that all healthcare providers, including the volunteers, get a flu shot. That is based on the Centers for Disease Control evidence that we need our workforce not spreading the disease. And so the hospital is following good evidence, but it's impacting the volunteers. So there's that information, and also at the same time some discussion about a geriatric dose used in flu shots, and that some of our local pharmacies were not providing that, and was that less or more or better or worse than the other flu shots. So with that was my overview of what I want to go into in the video. We know that the 2018 or 2019 flu season is one of the longest on record from the CDC. This marks also the 100th anniversary, if you want to celebrate that, of the Spanish flu epidemic that impacted this country and this world. So let's look at that, a little lesson in history. That 1918 flu pandemic is called the Spanish flu, killed an estimated 50 million people worldwide, and it was 675,000 in the United States. And I've also come to learn in the last couple of years in some ancestry studies that three of those 675,000 were my great-grandfather and two of my great aunts that died in Missouri and southern Indiana from that, leaving my grandpa, who was a 2-year-old, an orphan. And so that certainly impacted me. And we have learned a lot through the Centers for Disease Control and study, and through Dr. Salk, of course, in the vaccinations and how we prepare for this virus. So the flu is actually a contagious respiratory illness. It's caused by influenza viruses, not bacteria. They affect the nose, the throat, and sometimes the lungs. It can lead to minor, to mild, to severe illness, and then, of course, even death. But we're going to look at the vaccine and let history teach us from this last 100 years what we have learned. This example are some, they needed healthcare workers and volunteers, and so I thought these ads from 1912 through 1918 were interesting. Transmission measures. So we pass this through droplet form, usually through a cough or being in close proximity as much as 6 feet. They spread mainly by tiny droplets made when people cough or sneeze, and these droplets can land on actual other people's mouths or noses, less often actually probably from surfaces. And then usually they touch that and then touch their eyes and nose and mouth. So the children, of course, are at risk, and under the age of 18 are recommended. And my focus for this today would really want to focus on the people greater than 65 and older who are at risk of contracting this. And the period of contagiousness, you can spread before you know you were sick. They're most contagious within the first 3 to 4 days after it begins. Some otherwise healthy adults may be able to infect others beginning 1 day symptoms before symptoms develop, and even as long as 5 to 7 days after. So certainly if you or someone in your family is sick, it would be time to isolate yourself. Bringing this home just to Cumberland County, this was actually 2016, but 2 years ago, we were within the state and the country in a moderate risk. So certainly it impacts us locally. And this data is from the Centers for Disease Control. So how do I know if I have it or not? Diagnosis and treatment. Very common and very close to the symptoms of the flu. The big differences are cold is gradual and the flu is abrupt. Many people know exactly when they got it. So the chances are if you have the flu, it infects your entire body. You'll want to rest. Cold is more so just confined to your head and neck and nose and throat. But certainly when you have that dry hawking cough, sometimes a high fever, and they come on much more quickly than a cold. Get treated quickly. If you can get the treatment are some antivirals. And so if you, like Tamiflu, you've probably heard of, so you can get those within the first 48 hours. They're most effective. So please seek help. And it's diagnosed usually with a swab of the nose. So it's not, you're not going to get stuck or lab work or anything. The complications certainly can go to bacterial pneumonia, ear infections, sinus infections, and even in that older population bring on bouts or exacerbations of asthma, diabetes, and congestive failure. So please know your signs and symptoms. And ways to stay healthy, other than the vaccine, of course, are to disinfect surfaces, protect yourself. If you're immunocompromised with chemotherapy or an autoimmune disease or someone in your family, certainly wear a mask when you go out. Better to look silly than to get sick. And then to eat, a good balance. So, our vitamin C and veggies are always good for us. The most preventative measure that we have is using the actual vaccine itself. And you need to get it every year because flu-related illnesses and the risk of serious flu complications can result in hospitalization and even death. So in the 40s, you may remember hearing of Dr. Salk, researchers, University of Michigan, got that first inactivated flu vaccine. A lot of times those came from fertilized chicken eggs. So years ago, they would ask you if you were allergic to eggs. The Army was associated with a lot of the testing because World War I was certainly an epidemic time and we lost a lot of soldiers from the flu. So we need to vaccinate every year because it changes every year. And the flu vaccine predicted for 19 and 20 is formulated to protect against specifically the H1N1 and then the H3N2. There are just different names that the CDC gives things. And these are the strains that dominated last year's flu. So we're preparing now to prevent what will happen that they know from research what commonly occurs or comes back into the population. So reduce your risk with the vaccination, reduce the duration and the severity with the vaccination, and then of course by spreading it. But we know there are some common myths with the flu. It can cause the flu. How many times you heard that? Every time Aunt Agnes gets that flu shot, she gets the flu. Well, it takes 2 weeks to get immunity. So you could potentially have gotten the flu, already had it before you got the vaccine. Most people get it in a doctor's office or clinic where other sick people are, so maybe they were exposed to it there. But the evidence proves that you are vaccinated against influenza and still get the flu. There's a less risk of how bad it will be for you. So there's research to show that you are 2 to 5 times more likely to die in the hospitalized patients than those that were hospitalized who had been vaccinated. So know that myth number 1, you cannot get the flu from the vaccine. There's no live virus. Healthy people do need a flu shot because we're going to be around the people who are unhealthy, the very young, the older, and the immunocompromised. And we also know that this can also, even if you do get it, decrease the severity for you. It is not a bad cold. It is a serious illness from the symptoms that we looked at earlier. It is effective. The CDC, the Centers for Disease Control, show that that between 70 and 85% of flu-related deaths occurred in people 65 years and older. And that we know in these people, if you've had the flu vaccine over 65 years, improves that immunoresponse and protection provided by the flu. So statistically, we know that it is effective. Now to our geriatric dose. Their increase of specifically in the 65 plus, there is a dose that has added immune response builders. So it's made specifically so it's not a different in the flu vaccine part, but it's just a different formulation to increase the response of your immune system, being that in the older population, maybe it's not as quick to react. So that's what it's for. If you can't or don't get the geriatric dose, it's fine. Take the regular one. If you're really serious about it, go back, say February, March, and get another flu shot. And that's perfectly fine and acceptable. So we are seeing some early research that the geriatric dose is further decreasing. There'll be continued study on it. But please don't let the fact that it's not the 65 plus dose stop you from getting it. It's still an effective vaccine. It's not too late. This vaccine predicted for 2019 and 2020 is to peak in January and February. So this being December, and you need 2 weeks to build your response, you've still got time. Implications for our community. So if this is sourced from 2018, we tell that that illnesses in this are U.S. data were in the millions. The medical visits, what this cost is to our insurances and our Medicare population, hospitalizations, and the deaths are estimated at least 34,000. So we certainly know in this country that vaccination can help negate and improve these numbers. So there's still huge implications for the community. No cold is killing 40,000 people in the United States. You may have seen this meme that David skipped the flu shot. He got sick and recovered with a week, but grandma didn't. She wasn't so lucky. Or maybe it could say, but his 6-month-old child wasn't so lucky. So what we've learned is we know the flu vaccine cannot cause the flu. Healthy people do need a flu shot, especially those under 18 and over 65. The flu is not a bad cold, and if you ever had it, your hair would hurt. You would know. The flu vaccine is effective. We have proof of this in data and research from our Centers for Disease Control and all over the world, the World Health Organization. December is not too late. Might not be your best Christmas present, but you might just put that on your list. These are some references I listed as I've researched this for my presentation. And finally, it's not too late to fight the flu. The majority of influenza-related deaths still occur in folks over 65 years, and only 65% of them get a flu shot. So I hope this information has encouraged you to get one, to volunteer at Cumberland Medical Center, because they'll give you your flu shot for free, even if it's not the geriatric dose with that boost of immune prompt, that they'll give you one in the spring to boot. So please take this opportunity to protect yourself and those you love against the flu, and volunteer at Cumberland Medical Center. It's a great way to serve. Don't forget your flu shot. Thank you.